Good morning, Dr. Lauren Martin. How are you?
Good morning, Janet. I'm great. How are you?
I'm wonderful. Welcome to Courage in Conversation. I'm Janet Nordine, licensed marriage and family therapist, registered play therapist supervisor from Las Vegas Play Therapy. And my guest this morning is Dr. Lauren Martin. I'm so happy you are able to join us and talk about our play therapy symposium that's coming in September.
Thank you. I'm very happy to be involved. I think play therapy is such a critical part of the therapeutic process for kids, and I can't wait to speak at the conference.
Ah, so you will be speaking at one of our lunch and learns, and you are not a play therapist, but tell our listeners what you are and what you do, who you are, I guess.
Okay, I'm Lauren Martin. I have been interested in mental health my whole life, and I have a couple different degrees in mental health. I have a bachelor's degree in psychology, and realized that I wanted to take a different path. I wasn't really wanting to do the therapy only piece. I wanted to be able to also manage medication and things like that. So I went back to school and got a bachelor's degree in nursing. And after working as a psych nurse for a while, I went back to school again and got a family nurse practitioner degree, a master's degree, and started working in mental health. I've been practicing for 16 years. And then I also, during the pandemic, decided to go back to school and pursue my doctorate. So I now have a doctorate of nursing practice. And also, in addition to that, I did a program that also did a psychiatric mental health nurse practitioner program as well. So I have a double board certification as a family nurse practitioner and a psychiatric nurse practitioner, which I love because it allows me to holistically treat the patient in terms of medical, psychiatry, kind of all of it. Gives me more of a global lens.
You and I worked together for about 6 or 7 years, I think, at Healthy Minds, where we both were employed, and you are still over there seeing kids and taking care of people. And I loved working with you and collaborating with you. So when this opportunity to ask somebody to speak on collaboration, I was like, of course, Lauren, come on and talk. Tell us a little bit about what your presentation will be and what the topic is.
So, my presentation is going to really focus on interdisciplinary collaboration. One of the things that I loved so much about working with you was our ability to collaborate about our patients so well. And it's so easy when we're in the same building, we just pop over and have a conversation. But um, I have found through working with therapists that are at different, community agencies or private practices that we can still engage in really meaningful and good collaboration. So is my title is Stop, Collaborate, and Listen, the Year of the ZFG Applications, Outcomes, and Original Research. So, what that means in a nutshell is I went through my own process of really understanding what a good collaborative relationship looks like. And honestly, the model of our collaborative relationship really was foundational for a lot of that. Um, Scientific outcomes show that care is so much better and outcomes are better for our patients when we have collaborative care.
Yes. I also really loved working with you and sharing patients that we could pop in each other's office, or even just a quick phone call was so great. Or I could even be in a session and send you the client's initials, and this is what's happening in this moment through a text or a portal, and we could collaborate in the moment, which was fantastic too. Which I don't think people really get that experience with a medical provider. This is what I'm seeing right now, and this is important for you because you're going to see them right after I finished here. I really love that piece of it. Also, when we had downtime or maybe somebody was late for a meeting, we laughed a little, which was important.
Yes, absolutely. And in terms of that collaboration, where maybe I would see that patient once a month, you're seeing them once a week, sometimes two times a week, and being aware of my medication plan, being aware of what your therapy treatment goals are to make sure our goals are aligned, I think was really helpful for our patients.
Yeah. And often I would see something on a weekly basis that you would have insight into because you saw them for your one appointment, or they wouldn't tell you about it, or you wouldn't know. So it just came up. And being a play therapist, I see things differently than just hearing words and language. So it was fantastic.
Yeah, it was wonderful. And I would love to have every provider be able to experience those kind of collaborative relationships because it benefits them so much. It definitely benefited me and it also benefited our patients.
And I, as a therapist who doesn't, I understand medication for and how it works, but I really got to understand like the why certain things are being prescribed for certain people and how it worked. And obviously, I'm not giving medical advice, but I understood like the side effects, or if they take it at night or take it in the morning, or whys and hows of all of that. So it was super helpful for me to grow and learn as a therapist as well.
That's awesome.
So you and I have a shared love of Taylor Swift, and I tribute or blame, I'm not sure which it is, to my increased appreciation of her. We both were able to attend her conference or concert here in Las Vegas on different evenings, but I love that shared passion as well. Enjoying her music, what she stands for, I think, but that's something the collaboration brought, not only friendship and collaboration, but this shared, you know, meme sharing and Taylor Swift sharing. And it's been great fun too.
Yes,
Personal side of things.
it's been wonderful. And I feel like within the professional realms of, meeting all these people, we're spending so much time with our patients and clients, and we're spending so much time with each other. There is a personal benefit to having
Yes.
those positive relationships, especially when you feel supported in your own practice, right? When I feel
Yeah.
supported in my practice as a nurse practitioner and I have a question or I'm seeing something and I need someone to bounce something off of course I can go to my psychiatry colleagues, but it's also nice to have a member of the therapy team to be able to bounce ideas off of, or I'm thinking about changing this and can you keep, let me know if you see a change in their, you know, cognition or anything, or are you noticing any side effects, or you letting me know that, okay, we're starting trauma work, maybe just be on alert that we might be noticing some things. I think that these relationships help strengthen personally,
Mm-hmm.
professionally. It's
Yeah.
it's a win-win.
I agree. I agree. Um, so the conference is What About the Children? That's the title that I chose because I feel in Nevada, where you and I are both located, we are 51st as of 2022 in the nation for children's mental health. And we hosted the Super Bowl this year. We've hosted all these big events, all this money coming in. We're just not, we're not seeing those dollars trickle into care for kids. And so creating this symposium for people to come and experience, and the therapists to come and experience um, national, international presenters in children's mental health was just such a passion and goal for me. I'm so glad that you get to be part of all of it and get to also learn. I'm hoping that you'll pick up some things as well, just being present.
Yeah, I'm looking
So
forward to it.
yeah, me too. And you've been in Las Vegas a long time, like I have.
Yeah, I've been in Las Vegas about, let's see, we moved here in 2012, so about 12 years.
Wow.
And I noticed that moving here, there was definitely a deficit in mental health care, the availability of resources, of providers. And um, I've really felt called to be actively participating in improving the mental health care quality and resources here.
Well, our symposium will be held at the South Point Hotel and Casino, which is close to the fun, but far enough away that you don't feel like you're in the middle of everything, which I love. And it's September 26th to 29th, 2024. People can register at www.lasvegasplaytherapy.com. The early bird registration is coming up in April, so those people that are interested in attending need to jump on quickly. It's a group discount, so just lots of things happening, providing breakfast and lunch every day, um, taking good care of people, taking good care of ourselves, because this is hard work. And we also need to remember our self compassion practice in all of it.
Absolutely.
Yeah. So I have a few, I've been asking rapid fire questions, which I love doing.
Okay,
You
I'm
ready?
ready.
Okay. Which game show do you think you can win?
Price is right.
Hmm. What never fails to make you laugh?
My husband.
What song did you listen to on repeat?
Long Live by Taylor Swift.
That's a good one. What item is worth spending money on for you?
Travel.
Mhm. Last one. What's your final meal be if you're on death row?
Oh, steak, Oscar style, baked potato, salad, creme brulee,
Hmm.
probably with a side of canned SpaghettiOs with meatballs.
So random. I had no idea you would eat such a thing.
I
They
well,
sound good though.
get a little bit of that childhood nostalgia, right? To say goodbye.
There you go. Yep. I love it. Well, Lauren, thank you for joining us, and I really appreciate your time. And I'm so excited to hear you share that collaboration with our attendees.
Thank you. I'm excited to share and share my research and to learn so much from you guys as well.
Thanks so much.